Hello, Mr. B.
Hello.
So, I'd like to give you some discharge teaching so that you feel comfortable leaving the hospital and you know how to prevent from having to come back to the hospital for the same problem that you have. Okay?
Well, what problem is it?
Okay, well, um, so the reason why you came to the hospital this time was because of you having too much fluid in your system, right? So you've been doing dialysis, right, for several years now,
Yeah.
right? And every time
When I could make it.
uh-huh. And you notice that when you go to dialysis, you're losing quite a bit of fluid every time that you go, right? That's a part of the process.
Yes.
Okay, so it's going to be important that you attend all of these sessions. You're going 3 times a week. You should be going 3 times a week.
I have to go every time?
You do. It's very important for many reasons. One of which is there are a few lab values that we're looking at here, and one of those values is your potassium level. And the most recent value that we got for you was 5.2, which is a little high. And the dialysis is a filtering of your blood. And so part of that filtration process will reduce that potassium, since you no longer have your kidneys, what would your kidneys normally do?
I don't know. My kidneys make me pee.
Yeah, so the dialysis is doing the job of your kidneys.
Oh,
For what?
okay.
So if you had a very high value of potassium before dialysis, what would you expect that value would be after dialysis?
Well, I think if it was high, you want it to be low?
Right,
Lower?
right. So the dialysis would reduce that potassium level. And we don't want a high potassium level because it can affect the heart. So, as we talked about before, can you think of what we discussed and that you told me before would be an indication that your potassium might be too high? Do you remember what we talked about?
Well, I think if my potassium is high and it hurts my heart, it'll beat very fast and it won't feel good.
Right, yes. And so that's an indication of your potassium being high, which is just one indication that you need to have that dialysis done.
Okay.
Does that make sense?
Yes.
Okay. So we had the case manager in here, and she discussed with you, Mr. B, on some ways that that you can get to your appointments when you can't rely upon your daughter. Do you have that information?
Yes, I put it in my folder, and I know that there are a few numbers that I can call that will help me get to my appointment and back home. So I just call them and I tell them where my appointment is, when it is. I have to try to call them early so that I can get a spot so they can take me to my appointment, because I know that it's important and I need to go to my dialysis.
Very good, very good. And so dialysis, as we said, going to address the potassium, going to address the amount of fluids, right? And so as a part of that, since you are depending upon the machine to take away your fluids, what did we discuss that you need to do every day regarding your fluids?
Well, for my fluids, I have to watch how much I drink, and even if I'm thirsty, I should stay within the limits that I was given so that I don't put too much fluid, because I can't pee it out on my own.
And what did we say that amount of fluid can affect any of our organs in our body?
kidneys.
Did we, and did we discuss anything about how it might affect your blood pressure?
Oh, well, yeah, because I can't get rid of it myself. If I drink too much, it makes my blood pressure go up, and I don't feel very good.
Which is another problem that you have, right?
Yes, I do have high blood pressure.
Okay. So this is another reason why we want to make sure that you get to all of those appointments, right?
Yes, I don't want to not feel good anymore.
Yes, and it's another reason why you're going to watch your fluids and make sure that you're tracking them. Now, do you have a notebook that you like to take notes in, or something that you can reliably go to for recording all of this information?
I can try to buy one, but I don't know. I might have to see what I can do.
Just make sure, you know what I would recommend is make sure it's something that you like writing in. So, you know, get a nice, hardbound notebook that you're going to be able to easily find every day. Okay?
Okay.
Also, we want to make sure that you're tracking not only your fluids, but what else?
I know there's some things that I can't have in my diet, food-wise.
Mm-hmm.
Well, I do have the diabetes, so I have to watch my sugar levels, how much sugar I eat, how much carbs, and they're so yummy. And my potassium, as you said, my potassium can't be too high. Yeah, sodium, all the good stuff.
Yeah, and we had that discussion with the registered dietitian as well, right?
Yes, she gave
And
me some stuff to read.
right, and she mentioned how actually looking at what you write down as your food intake for the day is something that'll it's a really good way to go about planning your next day's food intake, right?
But why can't I just go to McDonald's?
Oh, it's so much easier to go to McDonald's,
It
right?
is so much easier. Just go there, tell them what they want, and they give it to me.
But didn't the dietitian also tell you about ways that you could replicate the food that you had in the hospital that you enjoyed so much without too much prep time?
Yes, there's some stuff. Definitely, yes.
Okay. And I believe that she gave you some actual recipes as well, right?
Yes, she told me everything I need to make what I want. Just have to buy it and keep it in my kitchen so that I can just put it together quickly.
And there was also the issue of your daughter, right? So you've come to really rely upon your daughter a whole lot, right? So
Yes, since losing my wife, I have no one, so I decided to move here to be closer to my daughter.
Sure.
See if she could help me somehow.
And based upon what we're hearing, we think that that's putting quite a bit of pressure on her, right? Because she's working, she has her own life to live as well, right? So we're thinking that you taking down all this information and writing this down will help you to sort of simplify the things that you're asking of her. Does that make sense?
Yes, I probably should. I don't want to be too much of a burden. So if I have everything simplified to make it easier, I will probably get better help from the people that are able to help me.
Sure. Okay, well that's good. We think that that's a really good start. We also gave you some resources as far as because we do know that you have a couple of other daughters that you've been close with in the past, and we want to make sure that if you have any desire to reconnect with them, seeing as how you are in end-stage renal disease here, we do want to make sure that you don't have any regrets about that. So we would like to make sure that if you're interested, you can see a counselor about that.
I think maybe a counselor will help, yes, because this end stage is That's as far as I'm gonna get. I'm not gonna get any better. Probably just want to be at peace with myself and who I am and my family at this point.
And with that being said, we also want to make sure that you're having the appropriate conversation with the case manager regarding palliative care. Do you understand about that? Did she explain anything to you about that?
I would like to know a little more about that. Palliative care. What does that mean for me?
So instead of us trying to fix the disease processes and trying to bring you back to 100%, we're actually just treating the symptoms. So we're trying to ease your pain. Of course, we don't. We're not trying to rush the process by any means, but
I hope not.
but we want you to enjoy the days that you do have, days, weeks, months, years that you have left, okay?
Okay, so basically what you just told me is that in palliative care, we know that I cannot get better, but you want to just help me feel better by treating the symptoms of my disease. So I'm not going to get better, but I won't feel as bad anymore.
That is correct.
Okay.
Yes. So that sounds like something that you want to have a conversation with the case manager about. Is that right?
I think I should, yes, because if I can't get any better, I want to at least be able to enjoy my time right now.
Okay. Well, we will make sure that you have that conversation, and the case manager will definitely set you up with all of the information that you need about that. We also, an important aspect of, or one of the limiting factors that we discussed was your income, that you're on a very fixed income right now.
Yes,
And
that's why I want to go to McDonald's, because it's so fast and it's cheap.
well, the case manager should have also told you about some resources that are available for good, healthful foods that are available to people who are on a fixed income. There are food pantries. Did you get the list of food pantries?
Okay, yes, that's what she was referring to.
Mhm.
Yes, there are food pantries, and there's also Meals on Wheels, I think she said.
Yes.
Those very good resources. Yes, I have the pamphlets in my phone. Take a look at them.
Sure.
And make sure to call. Yes.
And don't let your lack of transportation prohibit you from being able to access these things, because I do know that there is a way for them to get that food to you as well, even the food pantry items.
Okay, that's good to know. Thank you.
Absolutely. And we also might take a look to see if you are accessing the dialysis center that is the closest to your house as well. Things like that change regularly. There are centers that are coming up all over the country. So every once in a while, just make sure that you're checking to see that you are attending the one that's closest to your house, because that will put less strain on the people that are involved in your health.
Okay, so that definitely helps. And with the dialysis, I'm also on some medication. I want to make sure I'm taking my medications correctly.
Absolutely. One of the big medications for you is going to be your insulin. And we practiced that, right? We gave you the opportunity to practice
Yes, you gave
injecting
me
the insulin.
that piece of flabby stuff, and I was able, you taught me the right size needle, and it goes in subcutaneous, so it goes in my fatty tissue. And I have to pinch it, I have to know, always check my blood sugar before taking my insulin though, right?
Right.
Okay.
Great. And we also showed you about resources for acquiring all of those supplies as well, correct?
Yes, and I can
Okay.
even get them delivered.
Perfect.
And I also know for my hypertension can be caused from my diabetes, my hypertension. I'm taking the metoprolol, and remember that you said that when I take that, I have to be sure to not get up too fast, because I can get a little bit dizzy and my heart rate might go down.
Right. And do you remember why you're taking the calcium carbonate?
The calcium carbonate, I think that goes, yes, my potassium, the calcium carbonate helps keep my potassium within a certain level so that my heart doesn't go into palpitations or dysrhythmias, right?
Right. It adjusts that threshold.
Okay.
Right, exactly. Well, perfect. Do you have any other questions then?
I think right now I will read over all the resources that you all so graciously gave me, and if I have any questions, I will write it down in my book, and I will call and ask.
All right. Well, although it's always great to see you, Mr. B, we hope that we don't have to see you for quite some time, okay?
I hope so too. Thank you.
You're welcome.